Hi, and welcome now to Chapter 13, and we're going to be looking at the healthcare system in Canada. So we're going to get started on this in Part 1. Now, just so you're aware, now you probably are, but Canadians have access to more healthcare services and health practitioners today than we've had in the past decades, necessitating need for making informed healthcare choices. Because there's so many services and programs, it requires us to make some more informed healthcare choices. So understanding what rights you have as a healthcare patient in Canada is more important than it has been in the past. And so we're going to be touching on some of that in this particular part. Now, recognizing how to evaluate online health advice, news, and health claims requires a critical eye. More importantly, critical thinking. Now, in your text, you can sort of see, and we'll be visiting this part, becoming a knowledgeable healthcare consumer. With the advent of the internet and the access to reams of information on any number of topics, health claims are certainly among the tops. So being able to critique and be critically thought about what are the better ones and which ones are just bogus is important, because it has a huge impact on the quality of our lives, of course. So what we'll do, we're going to touch on understanding the differences between federal and provincial slash territorial healthcare responsibilities. And you'll find that in your textbook as well under Canada's healthcare system. And as well, we're going to understand the differences among various complementary and alternative medicine therapies. Now, complementary and alternatives, we'll hear them be referred to in your text, and I will refer to them as well as CAMs, complementary and alternative medicine. And we're going to look at some of those in terms of how they relate to the general overall healthcare system and some of the precautions and awarenesses we need to be aware of. Now let's get started on the chapter on traditional and complementary healthcare approaches as it relates to Canadian healthcare, okay? So we'll get started on this right now. So let's start with Canada's healthcare system, and we'll begin with a little bit of a history of our healthcare system and where it's been, where it started, and where it's gone to. So when we think back in terms of, well, where did it come from? Have we always had this healthcare system? Well, no, we haven't. The person credited for establishing Canada's healthcare system was in 1948 is Tommy Douglas. Now, Tommy Douglas was a politician out west. He was out of Saskatchewan. He was the premier of Saskatchewan. He was an NDP. And he's credited with beginning what we now know as our healthcare system. Now, by 1972, all provinces had joined the plan, creating a nationwide Medicare program for hospitals and physician services. And that's an important element because it began back in 45. It took until 72 before all provinces and territories were involved. In 1985, the Medical Care Act and the Hospital Insurance and Diagnostic Service Act, these were two things back in 1985 that were operating the overall medical healthcare system. They were replaced by the Canadian Health Act. And this act is based on 5 principles. And we're going to review them kind of on the quick. You'll find them in your textbook as well. First is public administration. Now, public doesn't mean the public, you and I. It means government. And so public administration means the provincial and territorial healthcare insurance plan, or in our case in Ontario, the OHIP. They're under the auspices of public administration, whereas the private services, those are fee-for-services. Comprehensiveness. Provincial and territory health plans must cover all health services. That's what they mean by comprehensive. Universality. All health insured services we, as in you and I, we have access to all health insurance services. That's universality. So it doesn't matter how rich you are or how poor you are, we all have access. Portability is number 4. The services you have in your home province, if you were to move to another province, your home province would continue to provide the support monetarily or in service-wise until the new province you move to begins. So it doesn't matter if you move, The healthcare that you've come to understand carries on. And so that's the portability. You can move it with you. And then the last is accessibility. Everyone deserves equal access to all healthcare services, regardless of where you live and what your income is. You might be aware, though, that these principles are not always achieved for all people all the time. There have been changes and there's been erosion of some of the principles to some degree for some people. Now you'll find more details of these in your textbook on page 357, so have a peek. Now we appear to be at a crossroads with regards to our Medicare system. Healthcare costs are prohibitive, meaning they're very expensive. Wait lines are becoming longer in places particularly like Toronto, even in the Barrie and Owen Sound area in some cases. And there are physician shortages in some areas of Canada. In April of 2001, the Prime Minister established a commission on the future of healthcare in Canada, with Roy J. Romanoff, as appointed as the commissioner to review the Medicare. Now you can see the document on beside me there. And it was a dialogue with Canadians, and it made recommendations. Now, we won't review all the recommendations. However, it basically said, we're not too bad, we're generally pretty good. We got some improvements to make. So let's look at what are the federal and provincial and territorial healthcare responsibilities. Now, not all parts of the government are equally responsible for all health care for all Canadians. The federal government is responsible for setting and administering national principles or strategies, or standards, for the healthcare system through the Canadian Health Act. So the guiding principles and the guiding direction of healthcare in Canada is a federal responsibility. Assisting in the financing of provincial healthcare services through fiscal transfers. Now what that means there is, in Canada, our taxes go to the federal government ultimately, and the federal government distributes our taxes to the provinces to deliver services like healthcare. And there's a formula by which to do that. And so the transfers are money that the federal government transfers to the provinces to administer not just healthcare, but post-secondary and welfare. So that's part of the federal responsibility, is to ensure that money gets transferred. 3, delivering direct healthcare services to specific groups. You'll see in your textbook there are specific groups that the federal government's responsible for when it comes to healthcare. Veterans, Indigenous people, that's the federal responsibility. In particular, when it comes to Indigenous persons, our reserves and the kind of healthcare that's provided there. And you know that that's been in the news over the last 10 to 15 years, and longer if you go back in history, certainly. 4, fulfilling other health-related functions. That's the federal responsibilities. Now, there are provincial and territorial government responsibilities as well. Each province and territory is responsible for allocating, if you will, or managing and delivering healthcare services. So the province of Ontario manages the healthcare system for hospitals and services in Ontario. BC does theirs, Alberta does theirs, and they're not usually all exactly alike. Secondly, provinces and territories are involved with their own planning, financing, and evaluating of the provisions of hospital care. So if there's a gap in Ontario, it's the Ontario's responsibility government-wise to look at that. 3, physicians and allied healthcare services. Ontario's responsible for their own physicians and allied healthcare services. Allied healthcare services are like chiropractors, massage therapists. They are other related services that aren't necessarily and always in hospitals. And then D, or 4, managing some aspects of prescription care and public health. That's the provincial responsibility. And so when we look at how healthcare is delivered that way, and in terms of, we have federal responsibility, we have provincial responsibility. So we are pretty fortunate to have one of the best medical systems in the world. And support our public healthcare system is still pretty strong. And so when we think in terms of, some provinces And are they all like Ontario? And is Ontario like all provinces? Well, some provinces have implemented new funding structures to deal with high healthcare expenditures. It's known as activity-based funding, and it's one of these new structures. And these are the following, I'm going to list them, they're in your textbook. Some of the following examples of these activity-based funding mechanisms. In Ontario, a health-based allocation model for local health integration networks. These are LHINs. Those of you in nursing will be familiar with this. I've got beside me a map that shows the LHINs of Ontario, and specifically we're in the Southwest LHIN. And these are the hospitals and services that are linked together into an integrated network. And it's determined by population-based factors that include age, gender, socioeconomic status, rural geography, and patient flows. And you see there beside me, there's, we're in the Southwest LHIN, that's Bruce Grey County, but you can see it goes all the way down to London. Now, British Columbia government, it distributes funds to the largest hospitals based on the patient-focused services, where dedicated funding will be available to the hospitals offering the lowest price for surgery. Now, that doesn't necessarily happen in all provinces. That's the way British Columbia is handling it. Alberta, its health services introduced activity-based funding for its new seniors care plan. And so when looking at seniors issues, that's become a big one. Activity-based funding is also being used in Quebec. It's related to the hip and knee replacement programs where they get funded according to people coming in and how many people come in to get that service. Ontario, British Columbia, Quebec are also implementing reforms to reduce the cost of generic drugs. Bundled payments are another funding option, and it's designated to cover the fixed time period. So bundled would mean you get this amount of money to deliver this service over this period of time, after which you apply for more bundled payments on an annual basis. So, Canada's healthcare providers. Let's consider what we can do and what we can understand about that. According to the Canadian Institute for Health Information Report, between 2013 and 2014, these aren't the most current, but I'm going to stick with your textbook and the data that's in there. There were 79,000 physicians in Canada. And in 2014, there were 406,817 regulated nurses. There was also 3,966 nurse practitioners, 1,923 licensed practical nurses, and 5,689 registered psychiatric nurses. And these are the numbers that you'll find in your textbook, but to give you some idea of the scope of practitioners. Now, on one hand, you might be going, well, that's a big number, but depending upon where you live, that might not be as big as you'd like it to be. You might be underserved in some capacity in healthcare. The skills needed by healthcare professionals working in Canada vary, and in the scope of practice of healthcare providers is changing, and that becomes a really big issue. The scope of practice is basically what your job entails, and what your job entails, and you try not to step on each other's toes. It's like a line in the sand. You know, your scope of practice, you can't do these things, but you can do these things, and these are the things that are your responsibility. And it's important with a changing healthcare system, then the scopes of practice change. And so this is oftentimes a source of a lot of conflict in the healthcare system. Canada has many universities and colleges that train physicians to become doctors. You must earn your undergraduate degree, then attend medical school before writing a set of exams in the final year of studies. The exams, these are set by the Medical Council of Canada. Now, they're not the only ones that get educated, as I can say that in our class we have nurses, and nurses take academic courses as well. Now, aside from the general practitioners, the GPs, other types of medical professionals include gynecologists, dermatologists, family practitioners, orthopedic doctors, urologists, pediatricians, endocrinologists, and oncologists. There's all kinds of ISTs, and there's all kinds of services within hospitals, and lots of people go through and get additional training to get these extra specializations. Careers in the healthcare field also include those of the allied sector. Now, I mentioned this earlier, and here's some examples: dietitians, nutritionists, medical laboratory technicians, dentists, health information educators, addiction counselor, pharmacists. These aren't necessarily hospital-related jobs, but they are related to the healthcare field, and that's what makes them allied sector. All right, so as mentioned earlier, your medical rights are more important now than they've ever been, in part because of the size and the bulk of what is our healthcare system. Canadians have access to their own medical records and the right to have those records kept private. Privacy has become a very important issue as patients' records are now being computerized and stored in large databases. And as you can probably imagine, if it's computerized, it's also able to be hacked, or, and this has become an issue both in the healthcare services and in post-secondary educational places, where people can access records of others that they have no business accessing. And that has become a big issue. And so we put a fairly high premium on privacy. And so that's why we have such a high premium on privacy. Patients also have the right to receive treatment that is provided with a reasonable degree of care. No willy-nilly approach to handling healthcare. We've got to do so with the education-based skill set that is expected. We don't want practitioners running away or not doing things they should, and we want credentialed professionals skilled at their responsibilities to be doing that care. As consumers, you have the basic right to help ensure that you know what any potential dangers, receive competent diagnosis and treatment, and retain control and dignity in your interactions with healthcare professionals. And certainly, because people who might be using hospital services may have some very high needs, or even just mediocre needs, it's stressful. And so being able to have that quality care, that responsible, people who come to you and provide you with that good support is really important. You can designate someone else to make decisions about your care, and especially when you cannot do so, you can have a designate, and there's a process by which to do that. Canadians have the right to give consent to donate the organs. We have a Be a Donor campaign that's been going on for some years, where donate the organs while alive and have organs removed in the event of an accident, illness, or injury that leaves the brain dead. We are able to donate organs, and there is a system in place to make connections between organs that are being donated with people who are requiring donor organs. By law, you have the right to give your informed consent for hospitalization, surgery, and other treatments. Informed consent is a right, not a privilege. So informed consent is also required for research studies. If you're going to be involved in a research study, whether it be done at a hospital or in a healthcare providing system, you have the right to be informed about what you're to be involved in, what the risks are, and have outcome expectations. All right, what about becoming this knowledgeable healthcare consumer? Well, we'll start with self-care. You should know your own vital signs. You don't have to be a doctor to know a lot of these things. What's your body temperature typically? Your pulse or heart rate. There's apps for these things. Respiration rate, your blood pressure. You can go to the Shoppers Drug Mart, put your arm in a little unit there and get your blood pressure. These are things that we should know. And we can also be aware of how they compare against what our normal readings. Know what a normal range for someone your age would be for heart rate is an important element. There are numerous home tests available to help consumers monitor everything from pregnancy to blood pressure levels. And so we really can't be ignorant of our own personal domain. So try to do what you can to find out what makes you tick. So how can I evaluate online health advice? This becomes very important because so much is available online and so much of it is not good information. The internet permits ease of access to cutting-edge medical knowledge and bridges the communication gap between high-tech medicine, However, it also has, and as I'm sure you're fully aware, serious drawbacks. The sale of internet prescriptions has become a controversial issue in Canada and the United States. Concerns about public safety, as you can only imagine. Cyber docs offer virtual house calls with board-certified physicians who engage in private chat sessions on minor health illnesses and prescribed medicine. Now that can be done where if you've already been prescribed medicine, you could then use this service in an online to say, here's some experiences I'm having. Would this be something that I would expect as a side effect of this medication? That's about the most that they can do. They can't really prescribe very much because they're not able to take any body information from you while they're doing it across the internet. Health Canada is attempting to play a role in electronic e-health issues. That's been a bit difficult over time. If you follow the e-health issues over the last 15 years, it hasn't always worked very smoothly for Canada at this point, but it is an area by which it would make it easier to move from anywhere in Canada and have your records be available. When evaluating online sites, health sites, be sure to check the creator, who's the creator of the website. Look for possible biases. If it says .com, be aware of that. .com just means commercial. That means somebody's selling something. Now that doesn't always mean bad things, but it might not necessarily mean good things. So check for possible biases, check the date of the page that was last updated, check the references. If you can't find references for claims that are being made on a website, move on. Consider the author. If the author is not credible, or you can't find them through another search to see who they are and what their credentials are, then move on. Be a critical thinker. It's your health that is at stake. Now see page on page, I think it's 361 in your textbook. You'll find a little more detail on this. Okay. I am going through this a little bit on the quick. You'll find this material in your textbook as well. Evaluating health news. Now, although medical breakthroughs and cures do occur, most scientific progress is made one small step at a time. Now, part of this is because they're going through the scientific method, and doing credible research doesn't happen in a week. It requires to use the scientific method, it requires that time be done, and it requires many trials to be able to make any sort of claim. So all of the kinds of things that occur in healthcare that are progressive, that are credible, take time. Medical opinions invariably change over time, sometimes going from one extreme to the other. When hearing about medical advances through the media, look for answers to the following questions. Who are the scientists involved? Where did the scientists report their findings? Is the information based on personal observations? Does the article report, or is it an advertisement including words like amazing, secret, quick? Is someone trying to sell you something? Does the information defy common sense? Now those are good questions to ask. Now, for example, anytime that you see a pill that says no exercise, no diet, this is going to make you slim and trim and have 6-pack of abs and be able to run a mile in under 6 minutes. Question that. There's nothing that we know of science-based that allows us to do nothing and get healthy. Eat well and exercise. That's it. That's what we know. And so when we look for things, be careful, use your critical thinking skills. So how do we evaluate health claims? Well, millions of dollars are spent on medical quackery. Now that's the word being used in your textbook, and I would certainly support it. It's unproven health products and services. Watch out for marketing techniques such as bait and switch or brand loyalty approaches, product misrepresentation. There are a lot of doctors, some are legitimate doctors, who promote products that they're being paid to promote, but there's no science behind it. In the fitness and health industry, there is a direct emphasis on physical appearance and sales pitches that attempt to make you believe that getting or staying fit is easy. Many fitness facilities hire people with no knowledge of medicine or health. So be a conscious consumer. There isn't a lot of easy ways for health. That is a time one way that I can imagine, and it helps me understand, is that I can get unhealthy. I can eat bad stuff, stop doing any exercise, but it's not going to have an impact on my body for a while. Months maybe. Maybe even if you're younger than I am, years. So anything that's going to get us healthy isn't going to happen in weeks. It might take months, even years. My current plan to get back to running and run a half marathon began in September, middle of August. I'm just now getting to where I'm running on the average about 25 miles a week. That's taken me months, but I have a long history, 45 years of running. And so my body's preparation for running might be different than somebody who's starting to run for the first time in their life. But it's taking me months. And it's going to. And that's just the way health is. All right? So there we go. Part 1. I hope this has been helpful. And please take a moment to go look at Part 2 when we explore healthcare further. Thank you, everybody. Carry on.